What is autism spectrum disorder? Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. The disorder also includes limited and repetitive patterns of behavior. The term spectrum in autism spectrum disorder refers to the wide range of symptoms and severity. When autism spectrum disorder begins. Autism spectrum disorder begins in early childhood and eventually causes problems functioning in society, socially, in school, and at work, for example. Often, children show symptoms of autism within the first year. A small number of children appear to develop normally in the first year and then go through a period of regression between 18 and 24 months of age when they develop autism symptoms. Is there any cure for autism spectrum disorder? While there is no cure for autism spectrum disorder, intensive early treatment can make a big difference in the lives of many children. What are the symptoms of autism spectrum disorder? Some children show signs of autism spectrum disorder in early infancy, such as reduced eye contact, lack of response to their name, or indifference to caregivers. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose language skills they've already acquired. Signs usually are seen by age 2 years. Each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. Let us discuss some common symptoms of autism spectrum disorder.
Some common signs shown by people who have autism spectrum disorder are
social communication and interaction. A child or adult with autism spectrum disorder may have problems with social interaction and communication skills, including any of these signs. Fails to respond to his or her name or appears not to hear you at times. Resists cuddling and holding and seems to prefer playing alone, retreating into his or her own world. Has poor eye contact and lacks facial expression. Doesn't speak or has delayed speech or loses previous ability to say words or sentences. Can't start a conversation or keep one going, or only starts one to make requests or label items. Speaks with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech. Repeats words or phrases verbatim, but doesn't understand how to use them. Doesn't appear to understand simple questions or directions. Patterns of behavior. A child or adult with autism spectrum disorder may have limited, repetitive patterns of behavior, interests, or activities, including any of these signs. Performs repetitive movements, such as rocking, spinning, or hand flapping. Performs activities that could cause self-harm, such as biting or head banging. Develops specific routines or rituals and becomes disturbed at the slightest change. Has problems with coordination or has odd movement patterns, such as clumsiness or walking on toes, and has odd, stiff, or exaggerated body language. Is fascinated by details of an object, such as the spinning wheels of a toy car, but doesn't understand the overall purpose or function of the object. When to see a doctor. You should see a doctor if your child doesn't respond with a smile or happy expression by 6 months, doesn't mimic sounds or facial expressions by 9 months, doesn't babble or coo by 12 months, doesn't gesture, such as point or wave, by 14 months, doesn't say single words by 16 months, doesn't play make-believe or pretend by 18 months, doesn't say 2-word phrases by 24 months, loses language skills or social skills at any age. What is the cause of autism spectrum disorder? Autism spectrum disorder has no single known cause. Both genetics and environment may play a role. One of the greatest controversies in autism spectrum disorder centers on whether a link exists between the disorder and childhood vaccines. Despite extensive research, no reliable study has shown a link between autism spectrum disorder and any vaccines. How I can prevent autism spectrum disorder. There's no way to prevent autism spectrum disorder, but there are treatment options. Early diagnosis and intervention is most helpful and can improve behavior skills and language development. However, intervention is helpful at any age. Though children usually don't outgrow autism spectrum disorder symptoms. They may learn to function well.